The CDC Foundation and the Kwame Nkrumah University of Science and Technology have joined forces to undertake a study on drowning in Ghana. Drowning is the third leading cause of unintentional injury and death. The results of the study will be used to develop a comprehensive drowning prevention strategy in the country.
The data and the findings from this study will provide critical information about the burden and the circumstance of drowning in Ghana. It will help inform drowning prevention interventions that will be the most effective for the most affected communities in Ghana and ultimately save many lives. Further, we will have national estimates of drowning incidents in Ghana, which I believe would be the first of its kind in Ghana, in the region, and also in the continent. So we should be very proud of this distinction for Ghana.
Drowning is a matter of concern to various agencies as it claims lives each year. When someone drowns, everyone gets affected, from the fisherman to the various ministries to the police and businessmen. Speaking on behalf of the Minister of Health, Dr. Wisdom Atiwoto.
At the Ministry of Health, there are two key policies we are working with: the National Health Policy and then what we are calling the Universal Health Coverage Roadmap. And both of these key strategy documents mentions or identifies research as one of the key strategies for attaining an improved health status for all Ghanaians. But when we look through many of the things we are doing at the ministry, realize that there's no policy on health research and how we can leverage research to improve on a lot of the interventions that we are making. There's a lot of investment in interventions, but we have not really sat down to see how research and research findings can be used. We talk about it every time, but we don't have any key structure to undertake that. So at the Ministry of Health, we are currently working on a national health research policy to leverage findings like these into our programming towards improving the health outcomes of Ghanaians. It has become very essential. So the ministry, with its support stakeholders, are hoping that this research policy will give the direction and provide a framework for the promotion of relevant research towards the attainment of sector objectives.
Here are the objectives of the KNUST CDC Drowning Research Study shared by Professor Emmanuel Nakua, a member of the Ghana Drowning Research Team.
To be able to describe drowning incidents is to be able to develop some intervention strategies. And that is why we collected the quantitative and then did some focused discussion to get information from individuals as to what they think are some of the strategies that can help us prevent drowning in the future. So going forward, our aim is to develop this, make noise about this drowning strategy so that the needed agencies will take it up.